Welcome to the Acts 28 podcast. I'm David. I'm here with Marv. We are here with Dr. Amanda Donnelly, DMD. She is located at 742 Graham Road here in Cuyahoga Falls. And also her dog Pretzel is joining us today. So if you hear Pretzel talking with us, we're so glad that Pretzel can join us. Today we just want to talk with Amanda about her calling, her business, and what she does. So Amanda, we're so glad that you can be here with us today. Can you share with us briefly just a little bit about your dentistry and your practice here?
Solo practitioner here in Cuyahoga Falls. I've been here for 20 years. It's hard to say. Before that, I served in the United States Navy as a dentist for 3 years. I did my residency and then took 2 years with the Marines after graduating from dental school. So I had been here for a long time. I actually did a short stint in Cleveland when I first got out of the Navy because I was stationed in North Carolina. It's hard to look for a job, across the country. So found a job, didn't go well, found another job, didn't go well, wasn't quite what I was looking for. And so I was like, I need to own my own practice. So I bought this and I have been here ever since.
Wonderful. And so you're located at 742 Graham Road, Suite A in Cuyahoga Falls. So be sure if you're looking for a dentist, 742 Graham Road, Cuyahoga Falls, Suite A. So
Have a therapy dog who will sit on your lap and love you.
and they have a therapy dog. What dentist has a therapy dog?
Not many.
Not many that I know of. Depending what dental work you need, that really is helpful.
Yes.
Wonderful. And can you share with us about your education?
Dental school is 4 years. You do 4 years of undergrad and then 4 years of dental school. I actually took a year off in between. Um, Originally thinking I wanted to go to medical school, and then shifted gears because I met my husband, and he said, "Hey, I grew up with a lot of people who their parents are physicians and they never see their parents. So, do you really want that?" It's like, "No, I don't want that. I want to see my children and my family." So I went to dental school instead, and I think that was definitely a blessing because it's more hands-on, it's more artistic. I probably would, if I had gone to medical school, I definitely would have been a surgeon, and then I definitely wouldn't have seen my family. So it's more artistic. I enjoy it. I enjoy seeing my patients as families, and through all phases of their treatment, and kind of being the quarterback for a lot of different things that they need. So it's good. But anyway, so 4 years of dental school, and then after that, you can choose to do go into practice, or you can choose to do a 1 year residency in general dentistry, or you can choose to specialize. And I knew I was already going to go into the Navy, and I was already married, and we were about to start a family. So I did a 1 year residency in general dentistry, and then served my 2 years also doing general dentistry in the Navy before we got out and moved here.
Wonderful.
Well, fun thing, and I'm just going to go back to repeat something that I heard you say, that for me is I find it very encouraging because it lines up with part of my own personal journey.
Mm-hmm.
And that would be when you started looking for some place to work. You went and worked a couple of different places and it didn't work out.
Mm-hmm.
And then you came to the conclusion that you were unemployable.
No, I didn't say that.
No, you didn't. I did because you chose to start your own practice. And that allows you to do some things that allows all of the gifts that you were talking about earlier created to manifest in a way that you didn't necessarily have to go answer to someone about. That's where I come from when I say unemployable. Similar journey because I've done a lot in corporate America. And then every time over the course of time that 20, 30 years ago when there was always this downsizing, right sizing thing going on, which is now going on again.
Mm-hmm. Right.
It dawned on me then that I was unemployable and I was always trying to find other ways to do things to bring income into the home legally.
Right. Of course.
Um, and so that's what makes me say that.
Right. Well, it was interesting because, I did 3 years in the Navy and it was an amazing 3 years. Loved it. Loved every minute of it. I mean, there were some things that aren't good, but with everything. The reason I got out, otherwise I would have retired in the military, is because I had such a heavy student loan debt, and everybody knows you don't make as much money in the military. So I definitely didn't make enough to be able to pay off my student loans and provide for my family for a career. But it was a very positive environment. I had a lot more autonomy than you would think that I would have had. For some, for an organization that's known to tell you where to go, what to wear, what to do all the time. It, things were done morally and ethically for the best interest of the patient, for the best interest of the provider. And so if I, as a provider, said, I don't think this is in the best interest of the patient, I mean, there were some, things that, we were limited for, but it was mostly cost based. It would be done. So the difference, and I just want to clarify this, coming out, and the reason why I was like, I need to buy my own practice is because the two positions that I was working with practice owners who were not as ethical. Um, one was outright committing insurance fraud and lost his license. The other one was just clinically doing things that were substandard at best. And I was like, I can't do that. So the options were a little more limited just because of the culture and the environment of practices and the economy at that time. So that's kind of why, not because I was like, I have to do it for my work. Just saying, there were no options.
Well, thank you for that.
Sorry.
No, 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 no. As we said in the very beginning, it was going to be conversation,
Yeah.
and it was going to be done Socratically.
Mm-hmm.
And so that just means to lead somewhere. And so where you have led this part of the conversation, I was talking about earlier before we went live, about a good place. And so you spoke about some moral things that
Right.
just didn't resonate with you, and then the Navy allowed you to see a system
Right.
that also was up to the moral standards that were ingrained within you, and those are things that I see here, because it's very much like that,
Right.
you know.
Yes, it is.
And I can speak, as a patient,
Mm-hmm.
that it is 100% everything that you just said. Which has led to lots of other conversations about lots of other things,
Mm-hmm.
because I'm the same kind of person who is always looking for good places with relationships, good places with business, good places leading people to places that are better than wherever they're at. And you just said all of that in regards to how your practice functions. So I want to thank you for that. It wasn't that I felt like I had to be right. It was to lead to the story, to get more out of the story.
Yeah, you're gonna trick me like that. So
Well, he's too much trick.
He's good for that. And then I think, you mentioned about being ethical, especially today, a lot of people, they're looking for business owners who are ethical,
yes.
who's not just trying to get money out of them,
Right.
who's going to be honest and upfront. This is a passion for you. And for some, it's like a ministry that we want to do. So it's important for people to understand that, because we see all around us, there's business owners and people in leadership that are doing it for the wrong reasons. So they know there's someone that they can trust. You're not just here for the money. You need to make a living, but that's not your pursuit. It's just to rip people off. So people,
Right.
they pick that up when they meet you as a business owner. They know if you really care about them, or if you just want to get that money and get to the next person. If we could talk a little bit about your practice. So what age of people do you serve? All ages, so children and adults. Okay. And what kind of insurance do you accept? Do you accept insurance? Or how do people pay?
Yes, we do. We do accept insurances. We're in network with I think 3 right now. We do not accept any sort of Medicaid or any of those state funded programs because I think that's a whole, you could have a podcast about all that. But yeah, so we're in 3 PPOs, but anybody with insurance could come here and be out for all ages.
All ages. Okay. Wonderful. And you have a therapy dog.
And we have a therapy dog, Pretzel. She's amazing.
Yes.
Are we ready to talk about Pretzel? I can talk about Pretzel all day.
Mm.
She is a mini golden retriever. She's 10 months old, and we got her when she was 3 months old. So she's been coming to the office every day since then, and she's in training still. But she'll sit on your lap when you're getting dental work done. So she hasn't sat on your lap.
No.
No, but she is a huge help. It's amazing because we get these big burly gruff men in the gym.
Yeah.
And they just when she sits on them, oh my god, it's so cute. But people who are shaking, visibly shaking because they're so nervous and petrified, will sit so still because they don't, not because they don't want to disturb me or make my job easier, because they don't want to disturb the dog.
Right.
And then it gives them something to focus on other than what I'm doing in their mouth. And I knew it would be helpful, but I didn't realize how helpful it would be. And even patients who are not nervous about coming in, they will say, "You just made my day just seeing a dog." Who knew? I couldn't have anticipated that. So I'm seriously thinking about getting the second one. So I have one on each side of the office, but I'm not ready for that yet. That's like
That was one of my questions for you. Like, are you going to get more therapy dogs?
I had thought about it. I could train them for other people
Right.
at this point.
Mhm.
But I kind of want to get her fully trained first, and then maybe I don't know. We'll see where it goes. But it's been a lot of fun. She's adorable, and it's great seeing my staff loves her. The morale in the office, which I think has always been pretty good, is now even better, and they're just loving her. And I, Laura, and Laura was one of the ones that was a little hesitant about this when I first told them. I was like, listen, I'm getting a dog. I'm going to get a therapy dog for the office. What? And there were a few other ladies that were just like, what does that mean? Who's going to take this? Who's going to be responsible? Like, are we going to be doing this? What are we going to have a dog roaming around the office? Oh, it's not going to. I'm going to take care of the dog. It's going to be my dog. You guys are not going to have to do anything. And slowly but surely now, where's the dog? Oh, Gia took the dog out for a walk. I didn't ask Gia to take the dog out for a walk. But it's becoming a thing now. If I know I can't find Gia, who's my hygienist, who is one of the, she's a patient care provider. She's not someone I would ever tag to go walk the dog because she's busy. She's walking the dog. So it's just funny. And then Morgan, my assistant, she will walk the dog on Fridays for me too. So it's just really cute. She's adorable.
Now, tell me about the training because that's interesting.
For her training?
Yes.
You mean like how we did it and
Yeah.
the fact that it's ongoing? I work with a trainer. He's fantastic. His name is Joe DeBala, Diamond Canine. It's up in Willowitch area. And I actually found him. You talk about good placements, right? I love getting referrals from good places and good people. So I found his name. It was about 2 months before I got her. I knew I was going to get a puppy, and I knew about when I was going to get a puppy. And I had researched trainers, but hadn't picked one yet. And I was at the hair salon, and I had known these people forever. And my hairstylist was talking to another client about a puppy they had just gotten, how they were using this trainer. And I was like, that's the trainer I want to work with. I need his name and number. And he gave it to me, and then I accidentally deleted it on my phone. And then once I picked her out and I had reserved a time to go pick her up, I was texting my hairdresser going, I need this. You got it. Who was the client? Go back to my appointment. I need this guy's name and number. And so he was the only one I interviewed, the only one I worked with. He, his philosophy is kind of like Cesar Milan. You guys are familiar with the dog whisperer?
Yeah.
Very similar. So, I mean, we've met with him 7, 8 times. Like he meets with me, and it's mostly just teaching us what to do with her. But he comes to the office. He'll come to my house. We go to Pets Place Plus. But that's kind of it. It's teaching me how to teach her to do what she's doing. And she's just naturally done it. what she needs to do. She loves sitting on patients' laps. If I'm giving anesthesia and chit chatting with the patient before I'm ready for her to come up, she's back there going, are you ready? Can I come? Can you come? It's now right now. Yeah. And then she hops right up there and then lays down and goes to sleep. It's adorable. She's on Instagram.
Just the dog.
The dog. Yeah.
What's the handle for Instagram?
Dr. Pretzel, but instead of doctor with a C, it's Dr. Pretzel.
Dr. Pretzel.
Dr. Pretzel. So there's all kinds of pictures and videos of her working with patients, having fun outside of the office, training. Yesterday, she got to ride on an escalator for the first time. She was not a fan, but it was adorable. So she's fun. She's bringing a lot of joy to a lot of people's lives.
Right. I think that's wonderful. I think learning more and more that all of us need a therapy dog
Right?
or a pet or someone in our lives that can help us,
Mm-hmm.
support us. My kids keep asking me for a dog, and I'm hesitant to get one
Really?
because they take a lot of money and time. But I'm also afraid, like you said, I'm gonna say at the beginning, well, who's gonna take care of this dog? It's your dog, your responsibility. I'm gonna end up being in love with it. It's gonna be my dog.
But you're not going to be the only one in love with your dog.
I know.
Like, how old are your kids?
One's 11 and one's 4.
Oh, it's perfect.
Yes.
Your 11-year-old's gonna. Oh yeah.
Yeah, he's the one who really wants a dog.
I can give you this breeder.
Wonderful. That'd be wonderful. Yeah, I think we all need, and we're learning more and more. They're part of God's creation, and animals really can be nurturing to us. They sense when something's going on, even if we don't know ourselves what we're struggling with. Animals will know that something's not settling right with us, so they will come comfort us until we can figure it out.
Absolutely.
So I think that's a wonderful. So if you are worried about going to a dentist, come to Dr. Amanda Donnelly. They have a therapy dog here that will support you through that.
This is a funny story. We had a new patient come in who hadn't been to the dentist for over 40 years, I think. And she was just sitting in the chair. She was visibly shaking. I've literally never seen somebody so afraid to walk in the door. Her partner was with her, just kind of trying to provide some reassurance and comfort the whole time, right next to her, touching her arm, things like that. So I came in early on. Normally, the pretzel wasn't coming until the very end, but we knew she needed to go in because her partner had been a patient for 20 years. So I brought Pretzel in. Pretzel sat on her lap, and I was looking in her mouth, and all of a sudden, Pretzel started growling. She doesn't. Not like what she did when you guys walked in, where she was kind of like, "Hey, who are you? What's up?" No, this was like a, don't be doing that. What is going on? And she was pretty young. She was maybe 7, 8 months old at the time. And we look over, and her partner is just rubbing her shoulder, like is trying to again provide comfort. And she was like, "No, I got this. You back off." She's very protective of and she has done that kind of repeatedly. So now we get to the point where I have to tell parents if she's sitting on a kid's lap who's nervous, I have to tell the parent, listen, she might growl at you or bark at you because she's honed in on what she's doing and she thinks you're going to come over and do something. She doesn't know who you are, even though you think she can smell it. But it's kind of cute.
Yeah.
Now that I know what it is.
She's doing her job.
She's doing her job, and she just knows it. I never taught that. She was like, "Back off! I got this." Good here. Yeah. It was funny.
Wonderful.
That's absolutely amazing that she knows her place and how many people don't.
Oh my gosh! Right?
There's a lesson right there. So we can look at therapy a lot of different ways. But what it just did for me, spur of the moment, is it reminds me of how important it is for everyone to be able to find their good place. Pretzel knows hers.
She does. And that patient, so even after that, her partner stayed out in the reception area. But now this same patient just came in this past week. she initially needed some sedatives to get through an appointment. She now doesn't need any sedatives. She comes back by herself. Pretzel sits on her lap. She talks like you would never know it was the same person. And she's getting her work done, and she's going to be dentally healthy for a very long time. So it's just a really nice success story, right? You're right.
Wow.
Yeah.
Wow.
Mm-hmm. And who would have thought?
Yeah, I mean, it's just amazing that you have therapy dog here for people. So I know a lot of people getting dental work done can be scary, especially for children. And
Mm-hmm.
others, it's painful, even with the numbing. It's still nerve-wracking. So to have a therapy dog here, and you say you have someone who needed the pain relievers and treatments, but then eventually just having pretzel sit on their lap is what they
All she
needed.
needs, yeah.
So,
Yeah.
so we want to take a moment to let you know Dr. Amanda is here located at 742 Graham Road in Cuyahoga Falls, Suite A. So if you have any need for dental work, be sure to check her out. They have a therapy dog here, which will be loving and supportive of you as you go through this as well. She sees all ages of patients, but also they take any kind of insurance. So be sure to check them out, 742 Graham Road. Um, you have another question you wanted to ask?
He has many questions.
Well, I always have lots of questions, but the thing I want to say is this, that you, despite all of your apprehension, have flowed remarkably through this whole experience.
Thank you.
And so, not a whole lot more to say, except
No,
for, well, we've got an hour in. You want more?
I don't know. Do you want, what time is it? I've got time. I've got another half hour
Oh, well,
if you want.
We can do that.
then we can continue to flow.
So how many staff do you have here?
12. Yeah. 3 hygienists. We're three at the we're a little fluid right now. 4 at the front desk, so that's 7. 3 assistants. 10 plus me. And then my daughter is Pretzel's instrument. Switch counts because that's a big job. So yeah, it's a good sized staff. I am talking to someone, a specialist, who might be coming in to do some specialty work as well, with similar backgrounds, similar situations. So we can get rid of them. It's fun. I'm sorry.
Oh, that's wonderful.
Yeah. So we're I don't know. Maybe on the big side of a small practice. Maybe not. I don't know. It's interesting. We've had a big change this year in staffing. Actually, in the last couple of years, COVID was not kind to anyone, as we know. Definitely not to dental and medical. But so we've had a bit of a change in staffing since COVID happened. And this year alone, we've had 4 new staff members. So we just had our holiday party, our Christmas party we do in January. So we just had it on Thursday. And we had 4 new staff members who had never been to our Christmas party before. And I mean, we don't go crazy. It's not a bash, but we have a lot of fun. We laugh a lot. And so we were explaining to them kind of what we do ahead of time. We were like, listen, this just it's fun. Like we have fun. Like don't be afraid to go crazy here. And leaving, 2 of them were like, this is the first time I've ever had fun at an office party. What was my age? I was like, what? Like you work with these people every day. You should all know how to have fun together. How is that fun? It's your work family. So we try to have fun while we're working and while we're not working. And, we do have a nice work family. But, the one has been here for over 6 months. I think it was right after we got pretzel. So I think by now she'd kind of know the office culture. So for her to say, I've never been to a breakfast party that I like. I wasn't looking forward to it. You know us. Fun. Enjoy yourselves. Come on.
Yeah.
So it was kind of funny.
We're so ingrained to when you go to work, you don't have fun. You just do your job,
Right.
check in, check out.
Exactly.
But I think anymore, we don't want that for
No.
ourselves. We want to enjoy our work.
Right.
You most weeks you spend more time at work than you do with your family.
Absolutely.
And so it should be a place where you feel like you want to go. It's your passion.
Right.
And so I congratulate you for making that an experience for people, that place they want to go to work, they enjoy it, because most of us don't want to just check in anymore.
A good place.
It's yes. And I tell them that when I hire them, and like, listen, we're not a hair salon. I don't want a lot of drama. There's not a lot of gossip. I don't want to hear it. If you're gonna have trouble getting along with people, you're not gonna last a long time. We get along, we love each other, we support each other. We do our like kind of micromanage. You do your job well, and I'll stay out of your business. If you don't, then I'm in your business, right? But every person I hire on, I tell them there's three people you have to make happy to work here, and none of them remain. Go on. It's the patients, your fellow staff members, and you. And if any one of those three is out of whack, then I'm not going to be happy. You know, I'm going to know about it and get involved and change. And every single person that has left this office employment, whether by my doing or their own, one of those things has been out of whack. Every single one. So if all those things and everybody's happy, they do their job, they love working here, it all works out. So
It's creating a culture
it is.
for people to that they want to be there, they enjoy that, and if it's not a fit for them, it's okay.
It's okay.
Yeah.
Absolutely. This is a place for everybody. Absolutely. So, but yeah, it was fun. It was a good party.
And I always tell people, I hired you to do this job, so you don't need me overseeing every step you do with it.
Exactly.
If I didn't trust you to do it,
Right.
I would not be paying you.
Right.
So go ahead and do it. If there's a question, I can help with that. But I hired you to do this job. I trust you to do it. So go ahead and do it. And that gives people the freedom to feel comfortable when they can do that.
Right.
What you just said is reference to any business, you know, especially if it's service based.
Right.
That, and I just love that because I'm just playing it over in my head again and again. And I will give you credit the first two times that I quote you.
And then after that, you make it your own.
No, after that is not mine. No, I never go there. After that, I just say, I remember hearing this. But the patient, your coworkers, and yourself, that is, wow.
Yeah, I mean, we had somebody who just left relatively recently, and she was a great worker. We all really liked her. The patients really liked her, but she had some internal struggles as far as, I don't know if I want to work in dental anymore. It's a little stressful. She had some things going on at home that she needed to take care of with some extended family members. So she left, and we get that. We support her. We still are in contact with her. So we get that. But everybody has all of those things that are all different. And you know, you just have to get to know people and know what the situation is. Sometimes we can help with that and we'll walk alongside them. Like, hey, you know, we have one Rhonda's out with surgery right now. She's been out for 3 months, which has been very difficult for all of us to pick up the slack. But again, we love Rhonda. Patients love Rhonda. We love what she does. We will be here when she comes back. So it's it's a little different, I guess. Maybe not here.
Well,
It is.
yeah,
Is it?
it is.
It
Yes.
It's that's disheartening though, isn't it?
Yes.
Well, that's why it's resonating with me. Not that because it's disheartening, but because of the value that you allow people to create for themselves. That is huge. Um, and I'm speaking from a place of corporate America. I'm speaking of a place of a business owner. I'm speaking of a pastor, and a lot of those places. That that's just huge. Um, it's a dynamic. It's a very important dynamic to having a good place. And again, it just I can't get over it because it's just resonating with me in all three of those facets because it's what's most important.
And I think we're finding, a lot of employers saying, well, I can't find people to work. It's not because people are lazy, don't want to work. It's they now, coming out of COVID, I think, realized the value in ourselves, that we want to work somewhere that has meaning for us. We don't just want to get a paycheck. That helps to take care of our family, but we also want to be passionate about what we're doing and feel like we have meaning and purpose to that. So more and more people are realizing that's what I want, and some employers are hesitant to grant that to people. So you've not once mentioned you're doing this because I own the business. This is what I want. It's the patients, coworkers, and yourself. If any of those things are not lining up, then it's okay. Maybe there's another place you need to go to, and we'll support you in that. There's no hard feelings.
Right.
We all have different callings, which I thought was a good mindset to have.
Right.
And that is unusual for employers.
I mean, the days of just having a job, um, that mindset, the paradigm that goes along with that, I don't know that that exists in the same measure that it once did, where people just went to work, put in the time to get a check and go home.
It's not there anymore.
Well, I believe it's still there, but I don't think it's.
I think that we're in a really interesting crossroads culturally right now, where, especially for the younger generation, that with Instagram and TikTok, and they see people and all the influencers living their best life. So they want to go to work and clock out and then go and have all of these experiences, but then they want this culture at work too. And that's very hard to find where you have this positive culture where you make the money that's going to afford you this lifestyle that you see on Instagram. Well, it's just hard to find. I don't find it. I'm a dentist. Everybody thinks I should be rich and I should have three houses and travel all over the world all the time and be driving Maseratis and things. And that I will tell you, I'm on the opposite end of that spectrum, probably because it's business philosophy. But it is what it is. And so there's a little bit of that with COVID there. That was the shakeup. So, a lot of the reason why the medical and dental industry is struggling is because, these young people are coming out after COVID when huge companies are paying astronomical salaries and they clock in, they clock out, and they work them like dog for that money. But then they can afford to go live this lifestyle that they think they want to live, but at what cost? So it's kind of interesting. So when all of that started after COVID, like overnight salaries were not quite doubling, but almost doubling. And small business owners like me were just can't pay what it's going to take to even get somebody to come and interview, let alone keep them in the office. So it's taken several years for those individuals who went to go work for corporate companies. I don't need to name them; you guys know what they are, but the larger companies. And there's other companies now that you may not know the names of, but dentistry is changing a lot right now. But they've gone and they've worked for these large companies, and the culture has been the opposite of what we have here. They've worked themselves to death ethically. There were some issues culturally in the office. You're working with people who aren't fully trained, and all of the things that come with working at other large companies, and they just don't like it. And so now they come back and they're like, well, maybe I will take a slight pay cut to come back to a private practice in an environment that's more conducive to what they want. It's interesting.
Um, what I hear is again something that I've experienced, and that is you can make a lot of money, but money doesn't make you happy. Money doesn't bring you peace. Money doesn't. You can have stuff and be miserable. Um, and that whole adage of I don't know, just the insanity of working 60 to 80 hours a week doesn't leave you much time um, to really grow and to mature. And I can think of different times that I've done different things, even as an independent entrepreneur, where I allowed my mind to go to the business, and it led me away from my joy and my peace and what it was that I was really trying to accomplish to begin with.
And I think that happens just as a natural ebb and flow in our lives, and then also just in our business too. Because like right now, I'm kind of in that time where I'm working 60 hours a week right now because I have someone who is one of my right hands and does, she does a lot of work for me so that I have free time to do some of the paperwork and the normal business owner type stuff um, throughout the regular work week. I don't have time to do now because we're all chipping in to help while she's recovering from surgery. So it's a little bit of a grind right now, but it's coming to an end. I see a light at the end of the tunnel. I will be able to do my tax prep. Take that one's out. But it through the 20 years that has definitely ebbed and flowed, and it has a lot to do with staffing changes, like leave suddenly that quiet that we weren't anticipating, or just there's a pandemic, like things like that. Quiet. She's a little stubborn when she sees birds and squirrels.
Pretzel's doing her job here today.
Quiet. My trainer would tell me that I can make too many decisions right now, but considering the situation. That's his words were. She makes too many decisions.
Pablo.
Right.
I think a lot of dog owners can relate to you on that. Dogs making the decisions.
He laughed too because I'll ask him a question. He's like, "That's because you're at home versus work. Obviously, at work you'll let her do this too." Oh no, it's not let her do that at work. We're working. She's got patience. No, then when we go home, I'm like, "Oh, she's fed." And then I complain about it. So
Too fun. Too fun.
So, how can you share how your faith has helped shape your philosophy about business and dentistry?
I wouldn't say it shaped it. I would say that it's been foundational, and to the point where I don't even necessarily consider my faith because it's so key to everything. I try, it's definitely intentional when um it's intentional that I create a Christ-like environment in how I deal with my staff and my patients. And sometimes, not often, but I've been very intentional with who I hire also. And not all of my staff are Christians or Christ followers, but they definitely all have a strong moral compass. So that when a situation arises where we have to talk about some conflict resolution, um, and I have to kind of go, we need to give a little mercy or grace here. Like you have to, you know what I mean? Um, where I've had to kind of just remind them. And they have been very receptive to that because I've been intentional in hiring them. So, I'm not going to bring somebody in who's not going to be receptive to that little reminder.
Mhm.
So it's been key, but it's been foundational and it's been here all along. So, but it was very intentional. That answer your question.
Yeah, and I love that because the truth is the truth.
Mm-hmm.
Okay, and when I say that, I'm talking about truth with an uppercase T. And so when you talk about moral compass, that falls under that category of the truth. But when you walk the truth out in front of people, I believe it resonates with them. And I don't believe, or I always use this analogy, I've got a lot of Bibles for a lot of reasons, but I've got Bibles that weigh more than others based on the size. I don't break out my 25-pound Bible and hit people in the head with it.
Right.
Because that doesn't work.
No, absolutely not.
When you walk it out, people are more receptive to what they see in your actions than they are in what you say in your words. And so if the words and the actions don't line up, see, then that's where there's a disconnect.
Right.
And I believe scripturally that when we were made in God's image and likeness, that all of that involves at a point in time the spirit that's within us And when we walk out Christ likeness in front of people, it resonates with other people's spirit. And that helps to motivate them or to move them or to at least cause them to stop and think.
Hmm. Right. And that's my goal. And honestly, when I pray that I will be, I don't pray to do what you do. I don't pray to be on a pulpit or to be an influencer. I just pray that I can be a reflection of him and his love. And I feel like, because I just feel like that's my calling and that's maybe my spiritual gift. Um, so that's just what I try to do. But when we have the other thing we have new staff come on board that I have to kind of tell them is, I'm not gonna yell and scream at you if you do something wrong. And I've been really irritated at times, not often, but at times. But I have to go back and calm down because if I come at you in that headspace, it's not gonna go well for anybody. And something happens that we wouldn't want to happen because it's just a teachable moment because either they don't know, they don't care, whatever, but it's still a teachable moment. Now, if I come to you in with an educational frame of mind, like this is what happened, this is what I want you to do differently, and this is why, make this change next time, and then you don't do it, then we have something else to talk about. And that's just been how I've handled this from get go. And it's worked well for the most part. I've had a few people that have left and been somewhat surprised, and I think it's because they've not been used to or exposed to that sort of environment. They've just been screamed at when something happened that was not anticipated, not desired. So I was like, I've talked to you sometimes about something that you weren't doing properly.
Well, I heard something else as I was just listening to you, and I bring it up because it makes me laugh. Of course, there's a lot of things that make me laugh, but I can see different times when you've had different staff in the room when I was in the chair, and you would ask specific questions. And I'm seeing it now from a very Socratic place
Mm-hmm.
that you weren't necessarily asking the question for your own information, but you were asking the question for your staff's information. Because you said on a couple of occasions, this is how Marvin and I talk. Yeah.
Mm-hmm.
And I'll be sitting in a chair and you'll ask a question and I can see them going, and then you'll say that, and then you'll actually say things that are edifying to me, but I'm watching their response. Because when you leave the room, their whole attitude has changed. And not that it was bad to begin with,
Mm-hmm.
but it's changed because a light came on with them.
Mm-hmm.
And so I see how you play me. But anyway, and I don't mean that negatively. I'm just saying that I'm watching. That's it, just in response to what you were just saying about how you try to have Christ manifest in the environment. And that just came to me, and I'm like, oh, so that's how she did that.
I try. I'm successful, but I try.
Well, fortunately, whether my mouth is numb or not, I always have something to say.
You do always have something to say. I know, we need to start booking your extra time on her.
I'm the same with them. Let's meet for an hour. We end up talking for 3 hours.
Oh my gosh, yeah. And Mary too. Yeah.
I think it's important what you said. I asked about how does your faith influence what you do, but you said it's foundational, which means it's part of who we are.
Right.
We don't just pull it in when we need it. It's the essence of who we are. We stand on that. So I appreciate you sharing that and about your faith. And there's more to us, as business owners. We also have faith. It shapes who we are. It's foundational of who we are. And so we're also people that we have an identity, we have lives, we have families, we have faith, we have struggles. It's important for people to also know this is almost don't have it all figured out.
Right.
If anything, we're trying to figure it out more than anyone else.
right? And then a pandemic happens and then everything
Yeah,
figured out is
you have it all laid out and then,
figured out all over again.
oh, okay. Well, it can't happen again. Well, at this point, we believe anything can happen. And so you have to figure out as you go. Well, I want to thank you for sharing with us today. Dr. Amanda is here at 742 Graham Road in Cuyahoga Falls. They have a therapy dog. If you're anxious about going to a dentist, be sure to check them out. Pretzel is a therapy dog. She is on Instagram at Pretzel. So be sure to follow her on Instagram. And Amanda, thank you for sharing with us today. And oh, here's Pretzel. Let's see if we can get a close up of Pretzel. There she is.
Good.
Well, again, thank you for everything that you're doing and for your ministry and your work here. And thank you for your time today. We want to wish you God's blessings over your business and your ministry.
Yeah. Thank you for this. Thank you for pushing me into more of my thing.